I divide my time up between seeing patients and doing research. I like to think of myself as a physician who does research, not a researcher who does medicine. But I am involved in the funded research from the ACS, which is looking at obesity and colorectal cancer screening behavior. As well, I'm involved in an interventional study that is looking at ways to improve colorectal cancer screening in primary care practices. And as far as my patient care, I do the full range of family medicine. My research looks at the association of obesity and colorectal cancer screening. It uses a national database, the National Health Interview Survey. And what I'm trying to determine, is obesity a barrier to colorectal cancer screening? And is it sort of a differential barrier depending on the race, gender subgroups? So when I say race, gender subgroups, I'm specifically looking at black men, black women, white women, Hispanic men, and Hispanic women, because we know that colorectal cancer screening varies according to race and gender, as does obesity. If we are aware of the barriers and sort of who is and who is not affected by those barriers, then we can more effectively reach those populations who are at risk for not being screened. And you know, colorectal cancer screening has improved, but it still is, you know, in many states and places, it's still only about half of people, you know, get colorectal cancer screening. And those of us in that business really, you know, that's not acceptable. You know, that there's it's not even just screening. I mean, there's the opportunity for the primary prevention of cancer through colonoscopy, and people don't do it. And we've got to figure out why. And we know that people don't do it in a way that's not fairly distributed. You know, it's one of the reasons for disparities. So I think that you know, certainly my work's not going to correct the whole problem, but I'd like to think it's a piece in the puzzle. I really care about prevention, and as a physician, you really see too often the end point of things, especially early on in your training, because you're put into the hospital, you see people who are sick, and when you really realize and think about that if you had the opportunity to go back 10 years in some of these people's lives, and you could have gotten them to do, you know, a certain simple behavior that they wouldn't be in, you know, the bad position that they are, it can make you, you know, you get pretty passionate about prevention. People can't do research without money to support it. And from my end, it's especially challenging as a physician to find support to protect your time, to do research, because, you know, really there's a strong pull for you to be seeing patients, generating revenue, taking care of the volume, and so that ability to protect time to do things like, you know, research and advocacy and leadership is really essential.